What I hope to do today is to cover giving some idea and understanding about some of the roles of stress and trauma and mental health as risk factors for substance use and addictive behaviors. Understand some of the basic neurobiological mechanisms behind that. Understand protective factors in terms of looking at self-regulation and how that can be an effective means not only of primary prevention but also for treatment and recovery. And then recognize how mindfulness-based practices can cultivate self-regulation and looking at the neurobiology and cognition that comes along with that, some of the science that looks at how this can be so translational across different areas. And then explore some of the effective ways to integrate it not only into university, college education settings, but also into preschool, middle school, high school, and community settings as well. So before we begin, let's all take a deep breath and kind of transition away from whatever we were just doing on our way to get here. Maybe putting our cell phones aside. And just know that as we're going through the content or whatever, there's a lot of information, whatever, any point that you need to kind of come back and recenter, that you have the skills to take a deep breath in and a deep breath out. So having said that, let's roll ahead. So first thing I wanted to do was to ask, just for some input from the audience, about why is it that people use alcohol and other drugs or engage in addictive behaviors? Yes, sir? Escapism. Feels good. Pleasure. Self-soothing, yes. So far I haven't heard anybody say because they're bad people, criminals, et cetera, or whatever. And so often that's the challenge, is that we look at problematic aspects of this and not look at the whole person and the whole spectrum across the life. And so getting that in mind, if we're looking at this is what people, if they're looking at engaging in self-soothing behavior to avoid unpleasant moods or feelings, and inability to tolerate distress in other ways. So that's one of the key things when we look at what mindfulness-based practices can bring to folks, is ways to go within, drawing on our own resources and resiliency, regardless of what's going on around us, and to be able to redirect attention, to self-soothe, to re-regulate, and the like. So just really quickly, if we look at what some of the kind of common targets and risk factors are, not only for substance use, but also relapse. We look at issues of unaddressed traumatic stress, poor self-regulation skills, emotional dysregulation, anxiety, depression, exposure to violence. And then we look at what are some of the protective factors. And these are things that we look at that are strengthened, identified protective factors, and these are elements of the outcomes that there's a plethora of research on looking at mindfulness-based practices for cultivating these. Among them, distress tolerance, self-regulation skills, emotional regulation, psychological flexibility, right? Getting away from some of the rigidity. Reduced anxiety, reduced depression, and a decrease in traumatic stress and post-traumatic stress symptoms. One of the key things here, bringing it back to sort of the core of the program here at VCU, when we look at with college students over the past decade, the rates of stress, trauma, anxiety, depression have been concurrently increasing along with substance use related problems among young adults. So from the most recent American College Health Association data from 2018, one of the key things here, this number may look relatively low. So it says 1.3% of students are diagnosed with a substance use disorder. We know that that diagnosis and treatment is relatively low. 1% diagnosed with behavioral addiction. But if we look at this, even going back to 2015, that it represents a 30% increase. So it was a 0.8% in 2015 were diagnosed, and 0.5% diagnosed with addictive behaviors. Then we look at in terms of kind of what's going on with folks. So one of the things I was actually interested to see is that the percentage of students reporting, what the category of binge drinking seems to be down. I used to work in student affairs and did direct services with substance abuse counseling with students at SU, and our percentage of students that binge drank in the past 2 weeks generally hovered around 42%. So 42% used cannabis in the past 2 weeks. This percent, 3.3% have used prescription opioids, and we know the importance in terms of the risks for lethality with that. About 0.3% used heroin, and 3% abuse sedative hypnotic. So this is looking at not using them for prescribed reasons, but looking at using them for recreational reasons as well. Other key issues when we look at, so substance use doesn't exist in a vacuum. 22% reported being treated or diagnosed with anxiety, 18% treated or diagnosed with depression, and most treated with medication in both categories. 16% had seriously considered suicide. 85% felt overwhelmed, 53% felt hopeless. Then they looked at, this was the first time I'd seen this question and information on the American College Health Association survey, and they looked at sources of trauma and extreme distress. And as a faculty member, I can tell you that the issues that students come to class with and the inability to function is increasingly challenging. And I particularly find that among young men, I don't know if it's because they're more open to speaking with me about it, but a disproportionate percentage of young men really struggling with basic mental health issues and trying to get through the academic year. So 48% reported academics were a source of trauma, and I've never really looked at it. Source of stress, yes, but source of trauma, no. 15% reported dealing with a significant loss, so death of a family or friend. I surveyed students in my class. I surveyed them each semester for the past 4 years if they knew somebody who had died from an opioid overdose. And this past semester, 45% of the students directly knew someone who had died from an opioid overdose. And that's out of a class with 110 students. 30% reported this. Again, I was surprised to learn that almost 30% reported that their personal appearance was a source of trauma and extreme distress. So I think this also speaks to some of the larger issues here as we're trying to look at how do we address these factors. This, I think, has a lot to do with when we look at social media, comparison, and the directed diversion and attention outwards about how we present ourselves to others. And so what this has to do with mindfulness is we're looking at, you can't just keep Band-Aid picking on all of these different factors and trying to put out this fire and that fire, but going back into the individual and trying to work on core issues that apply across why these things become so distressful. This is, I'm not going to read to you, but I just, the key thing is I think that by and large at universities and colleges, we do a pretty good job of providing education information, but what students lack, when I'm not pointing just to students, but humans in the United States seem to lack, is personal resiliency skills and self-regulation skills. And so they get a lot of information about alcohol and other drugs, stress reduction, but maybe not adequate information about how to deal with grief and loss in some regards. So the other factor, too, are those things that go on in a larger context, and a lot of the work and the research I do around mindfulness has focused on working with people with traumatic stress, so folks in the community exposed to violence, military veterans, survivors of sexual assault, people who are survivors of childhood abuse and violence as well. So one of the key things is that to note that anyone can experience trauma, and about 70% of adults in the United States are exposed to or experience a traumatic event at some point in their life, and about 20% of those individuals go on to develop what we would call post-traumatic stress. But if you're in environments of chronic, toxic, ongoing stress, it's not really post-traumatic stress, it's traumatic stress. So one of the challenges with this is if we look at trauma and stress is that the part of the cognitive rigidity and then the physiological response that we have when we're constantly keyed up. So you're in the fight, flight, or freeze mode. That people have what we call a smaller or shorter window of tolerance, right? They feel dysregulated and unable to cope. They have a narrower band of how they do that. And so that's when we start to look at ways for self-soothing, ways for distracting attention, and the like. So when you get hyper-aroused, it's when you're looking at sleep problems. People are constantly keyed up, they're aggressive, they're responsive. If we look at hypoarousal, emotional numbing, difficulty with attention, disassociation, inability to think clearly, and people are very shut down. And so we reach out to substances, we reach out to our cell phones, we engage in other behaviors, trying to manage ourselves and keep ourselves within that shorter window of tolerance. I won't get into the neurophysiology of stress and trauma too much, but when we talk about stress and we talk about post-traumatic stress, people, the majority of people don't clinically meet definitions of post-traumatic stress disorder, but there's a similarity in terms of acute stress and chronic stress and traumatic stress that's occurring not only in terms of neurocognition, what's happening in terms of hormonal response, but also physiological sensations and the like. And so we look at sleep disturbances, substance use, depression, risk of suicide are key factors that are common among both trauma and stress. And then particularly problematic issues around traumatic stress or intrusive thoughts, nightmares, memories that you can't regulate, and the like. And so we look at emotional numbing, right? How do we find ways to numb emotionally? And again, it's reaching outside of ourselves for substance use, technology, purchasing, shopping, addiction, sex addiction, finding other ways to try to soothe ourselves and regulate those things. I won't bore you too much with this, but I do have some information in here because I think it's really helpful to look at. With mindfulness-based stress reduction, it's not just a singular session of like calming down and de-stressing and feeling good afterwards. If that happens, that's awesome. But it's really about retraining neural pathways and retraining cognition and being able to choose where you put your attention, recognize when you're starting to respond to situations, and then being able to de-escalate yourself as needed. And so the important processes related to that, then we start to look at in terms of what is our natural stress response and what happens in terms of the brain and the body. And so if there's one key thing to understand from all these things is that what you think literally changes your physiology. You can change your endocrine response, you can change your neurotransmitters simply by looking at in terms of what you are thinking and how you're responding to stress. Right? And if you're like, that's a bunch of hogwash or whatever, if you ever have watched a scary movie or whatever, there's nothing that's really happening. You're watching something, you're thinking something, and you see how your body responds and reacts to that. So that's just a gross example in terms of those things. But it changes not only cardiac response, but it also looks at in terms of changing areas. And when we constantly worry and think, and it's difficult not to these days, because as a society, we're very much on edge. We're at a very divisive point right now politically, socially, and that really affects everybody. Right? We start to see these numbers in terms of how youth are responding to things. The adults are feeling it as well. Right? And so when you're constantly thinking about some of the other aspects or whatever, we strengthen, the old adage of neurons that fire together, wire together, and that rumination, fear, whatever, that strengthens those mechanisms. So flipping back then to some of the other aspects in terms of this isn't about just what's happening in young adulthood and what's happening in adulthood, but there's an increasing recognition in terms of the research that has come out around adverse childhood experiences and things that we may or may not put the pieces together, but how these affect people. And it doesn't matter if you're an infant and you're 2 weeks old and you're pre-verbal, you're 5 years old or whatever, there's an imprint, there's a shift in terms of what occurs with folks. And so some of this has to do with self-regulation and some of it has to do with neurobiology risks. But we see that the risks for being a heavy drinker, the risks for being an injection drug user, the risks for smoking cannabis, for violence, et cetera, increase the more that people have been exposed to adverse childhood experiences. And this ranges from everything from the dissolution of a family, which can be divorce or it can be a significant relationship that shifts, to family members that are incarcerated, witnessing violence, and the like. One of the things that's particularly interesting, too, is that intergenerational trauma and adverse childhood experiences, trauma as an adult or whatever, what also happens is that there can be a dysregulation of the endocannabinoid system. So the endocannabinoid system we all have in our body, it responds to our own endogenous neurotransmitter anandamide, and it also responds to endorphins. And these things can get dysregulated. And there's some fascinating new research that shows that people with post-traumatic stress have a proliferation in their brain of the receptor sites, the CB1 receptors, which are the receptor sites that work with endocannabinoids. I'm sorry, not with endocannabinoids, but with endogenous and exogenous cannabinoids. So one of the things I think that this is really helpful to look at is when people, if we look at, what is the motivation for using cannabis, it can be recreational relaxation or thrill-seeking, whatever, but then for people who continue to use it and use it compulsively, a lot of that also has to do with that it's providing them with a positive reinforcement to meet a need of dysregulation on a physiological and a cognitive basis. And so I think that's helpful then to look at in terms of, again, moving back away from the judgment aspect of why people are using certain substances and recognizing the benefits they may be receiving from it, but helping people to find another way that's not going to be disruptive to clear thinking, sometimes problematic depending on what state and where you live in terms of legal complications and the like. But it's an important and we're just on the precipice of understanding this. We really just recognized and identified in the 90s the neurotransmitters that are key to this. The other thing, too, when we look at trauma and stress is that there's a bidirectional relationship between the two. And so if we look at how we're responding physiologically impacts our psychology, and how what's going on with us psychologically impacts us physiologically. And so if you look at, if you actually start to dig into things, all actions originate from physiological cues and signaling. So even though if you talk about, I was stressed about something, and stress might be a perception of something, the real origins of it come from a physiological sensing. And so even though we're talking about mindfulness, it's really mind-body connection. And we have pretty much become cut off in terms of, two different aspects of that. And so when we aren't able to regulate these things, then we are at increased risk for developing substance use disorders and addictive behaviors, and also for relapse as well. If we tie the pieces together again, the adverse or traumatic experiences can be in childhood, it can be in adulthood or whatever. The natural response is, again, fight, flight, or freeze in terms of what happens acutely. But then the protective components afterwards, then we're looking at in terms of hypervigilance, hyperreactivity, and numbing of physical sensations, numbing of emotional reactivity. And so these neurobiological sensations that we have in the body, there's also changes in the brain, because in order to be hyper alert, you have to have the amygdala is kind of the driver, and the security guard overrides most of the other processes. And so the security guard, you're always looking for threats and incoming information, and that's more dominant than the prefrontal cortex, which is essential for taking in information, short-term memory, making good judgments, and the like. So in order to manage some of these things, the reliable ways, not necessarily healthy, but predictable, reliable ways of numbing oneself, shutting down hypervigilance can be alcohol, other drug use, disordered eating, and the like. So I'm setting it up to look pretty grim and disappointing, but I want people to understand also this aspect of there's tremendous resiliency that comes out of suffering. And what we're really looking at is post-traumatic growth and resiliency that we're fostering through these practices. And this, I don't know if you know this, understand sort of the significance of the lotus flower, but the lotus flower will not grow in clear, clean water. It'll only grow in brackish, muddy, poor conditions. And so out of this sort of ground of suffering or out of the chaos and the muck or whatever, beautiful things can come. And it's exactly in the muddy waters where the lotus flower grows and blooms. And so taking that and reframing, helping people to understand kind of what their history is, or maybe contextualizing some of what they've experienced, but then also looking at the profound resiliency of that. And I think I'm probably preaching to the choir, because one of the things that we love about working with in this field is the tremendous resiliency that people bring to it despite all of the suffering. So if we go back to some very basic elements and we start to look at in terms of sort of brain operations and the neuroscience of craving, cues, and addiction, our senses, so again going back to this idea that things that all actions originate from sensing, is that there's smell, sight, touch, sound, taste, that things that we may or may not be aware of that are the initiation of triggers for craving. And so anybody who has ever tried to change behavior, particularly if you're looking around chemical dependency, whether it's nicotine, whether it's an opiate, whether it's alcohol, whether it's food or whatever, there are not only the people, places, and things that can be triggers, but there are subtle cues and things that we may pick up on. A slight scent of something that starts your mind thinking in a different area. And so again, going back into what do mind-body practices do, they help us to get in touch with recognizing on a very subtle level what these sensations are and what's happening, so you can choose a response to that. So if we look at behavior change or prevention around these things as sort of the habit loop, and how you can become aware of what's happening in the habit loop and then learn to choose and change a response to that, the first point that's essential is to see, does this thing show up anywhere? Maybe not. I'm not sure. Is to recognize and understand sort of what are the triggers, what are the stresses, what is the physical discomfort, what is the reaction, right? And so even the behavior of, like, if you're starting to get bored now and check your cell phones or whatever, that aspect of boredom, right? That key sense of I'm losing attention, I'm lost, this is too complicated, I don't want to hear, or whatever. Trigger, I know how to reward myself or whatever. I will look on Instagram for cute puppy pictures or something, and it becomes a reinforcing reward pattern of behavior. But on other more problematic aspects, it can be turning to alcohol, it can be shopping addiction, it can be binge eating, all types of things. And so we do these things. This is all part of the brain. We're set up in terms of the survival, right? We're operating just the way we were designed because it's a learned behavior and it's a reinforcing and rewarding, so we do it again. So this was important for us to be able to, like as cave people, to be able to forage and figure out like where the good mushrooms were versus the poisonous bad mushrooms, and then we could learn that we could go over here and get these and avoid those. It's the same mechanisms that are in place there, right? So we're operating as we were designed to do, but it's important to become aware of what these are and what the triggers are so you can interrupt and change the cycle or choose a different response and behavior. It's also layered on top of, when we look at in terms of our brain processes, suffering is at the core there. suffering is at the core. So it's not just suffering in terms of extreme examples of trauma that we might be thinking about, but boredom for many people feels like suffering, right? And so the brain is craving relief from what you perceive to be an unpleasant experience or situation. This is, there will be a quiz on this afterwards, so I'm going to hope that you take this. But this is actually an important piece, and the resources are on the PowerPoint or the PDF that are going to be listed there, so if you want to get into reading about these things afterwards. But one of the key things to look at in terms of understanding self-regulation, which goes back to where we direct our attention and how we respond to things, at the core of that, when we look at with mindfulness-based practices, is working with what's called the default mode network. So our default mode network is what we were just talking about. I'm bored, my mind starts wandering, I'm going off into all these different aspects. Next thing you know, you're down a rabbit hole, whatever. And the default mindfulness-based practices, particularly meditation, where you're training attention again and again to come back to the other areas, strengthens what's called the task-positive network and quiets what's called the default mode network. And so the cool thing is that the research shows that a reduction in terms of default mode network activity reduces mind wandering, and that's not just so you can do well in school or whatever, but mind wandering is a risk factor in terms of depression, substance use, and the like. And why might that be? Doesn't mean like that boredom and creative thinking is bad. But what happens is, if you're looking at in terms of mind wandering, it's closely tied with rumination, right? And so rumination on the past is associated with depression, and rumination and fear about the future is associated with anxiety. And these things can be huge triggers for developing unhealthy behaviors and huge triggers and risks for relapse as well. So for mindfulness meditation helps in terms of not only of working with an underlying, some of the key risk factors, underlying factors looking at related to trauma, related to stress, just regular stress, and also relating to craving, right? And the craving mind, as we said before, it's craving sometimes just to feel pleasure. It's not necessarily meaning that you're in a full-blown craving cycle with an opioid addiction or for alcohol, but it's also that craving for things to be other than they are. And so these are, what's helpful with this is it's a non-pharmacological means of managing anxiety, depression, unpleasant mood states, working with cravings, right? If anybody's ever tried to stop smoking, recognizing and knowing what those craving cycles are with nicotine. And it's also what we call an upstream prevention basis. So preventing problems beforehand. And so I'll whip through ahead afterwards and look at this work can be done with 3- and 4-year-olds, right? And so you're looking at primary prevention and how do we work at these factors as well. So one of the things I love about mindfulness-based practices is that they are sustainable. Once people learn them, they have the skills, they have the internal resources. You can't stop the stuff that's coming at you or the waves from coming, but you can learn to surf and kind of ride the chaos a little bit. Ultimately, these practices, I know that it can be very expensive to get trained and the like or whatever, but there's wonderful programs such as Brown University just got a substantial endowment where they're trying to bring free mindfulness training online and in the community to the masses. There's a lot of good, reputable resources because ultimately it's a skill you have within you. And so if you don't, most people don't have access to good mental health services, right? Even as somebody who works in the field, when I was trying to get help for family members, incredibly difficult, even for people with insurance. And so it's important not only for prevention, but also for sustained recovery as well. And ultimately, they're self-directed strategies. You can reset yourself. You learn to tolerate distress and anxiety on a moment-to-moment basis, day-to-day basis. and you can learn to intervene and with unhealthy and addictive behaviors and redirect your attention. So now here's for the research results from some of the work I've done. So if you would like to take a nap, feel free to go ahead and do so. I will not, but I felt that it was important, since this is a research to practice aspect, to put some of this information in here. And so these are just some of the key findings and outcomes from for 5 years now, I've been doing research on integrating mindfulness-based practices into curriculum in courses and measuring the outcomes. So we have control classes, and then we have intervention courses. Fortunately for me, it's the one aspect is it's a course called Cognitive Behavioral Stress Reduction, so it naturally fits right in there. But I have a lot of colleagues who are integrating these practices into rhetorical studies, interpersonal communication skills, mindful drawing in the visual performing arts and the like, or whatever. And what we found is that over the course of the semester, there's significant reductions in trait anxiety. So we're not just looking at state anxiety, but really changing in terms of trait anxiety, significant increases in mindful awareness, increases in self-acceptance, which I think is key when we go back to looking at the statistic that said 30% of students find that their personal appearance is a source of trauma and extreme distress. Significant reductions in using cell phone to regulate emotions, and significant reductions in the use of cell phones to avoid unpleasant feelings. These are a bunch of graphs, so I'll just show you so you can not have to read through stuff or whatever. But the turquoise line is the class that had the students who've had the mindfulness-based stress reduction curriculum integrated into their coursework. The control group, this is data collected during the same semester, so you control for all those factors that kind of go on, the academic trajectory life cycle. And so for self-regulation, the darker line is the control group, no change over the semester. Mindfulness, so here, of course, you'd expect to see significant improvements in that, but the key thing, if you look at mindfulness measurement constructs, is it's looking at fostering psychological flexibility. It's looking at fostering observing capacity for self and others. It's looking at self-acceptance, acceptance of others, cultivation of awareness, and the like. Using phone to escape difficult emotions. So interestingly too, this control class here is a course that I teach on addiction. It's called Dynamics of Addiction. So these students are getting the cognitive information about being aware of technology addiction, substance use addiction, or whatever. So it looks at that importance between, it's not just what do you know, but how do you apply these things? What kind of skills can you have to change these aspects? This is another wave of data, so looking at anxiety, and so measuring it at the beginning of the sort of intervention, 8 weeks into the semester, and then at the end of the semester, so that the mindfulness practice and training that is integrated into the coursework occurs in the first couple months of the semester. And to see that the results and the changes hold at least for a month afterwards is good to see. In the absence of any intervention, that it just increases for the students. So then now let's look at primary prevention. So I've had the opportunity to do some fantastic research with schools where they're already integrating these practices. So I've done some with preschools, done some with 6th graders in the Boston area, in the Philadelphia school district, and we're trying to do it in Syracuse City as well. And so what we found is that it fosters self-regulation. So there's an adolescent self-regulation inventory. Interestingly, as many times as we've used the same instruments in different studies, short-term self-regulation doesn't seem to change. And that's more or less the things like where I might be able to hold back the impulse to just poke you because I'm bored or whatever, and you're sitting next to me and we're in 5th grade and I'm bored. But long-term self-regulation, so those things that are needed in order to goal plan and to stay on track and to do things that are in your own best interest so you can move on to the next thing, there's significant improvements in that. With preschoolers, we found that it significantly increases what they call effortful control and attention. And that's pretty fantastic to be able to do that as well. Now, the preschoolers were not filling out surveys It was direct assessment, so if you're familiar with things like the marshmallow test and those types of things, it was things like that. More graphs, but just basically looking at, this was with 6th graders in the Boston area. The blue lines are the intervention groups, the red lines are the control groups, and this is data where we're looking at, this is total overall self-regulation, and this is long-term self-regulation. What's important or interesting to me also is not only that there's improvements where they integrated mindfulness into the curriculum, but in the absence of anything, what do we see with the red line? So there's decreases in self-regulation over the course of the academic year in the absence of anything. With this study too, another great thing is this was integrated into the English language arts, or would be like your English class or reading class. And they, for 1 minute at the beginning of class, 3 times a week, they would do a single yoga pose and a 30-minute sitting meditation. And so what we found was, it doesn't have to be an elaborate program, but it was routine, it was continuous training, because when we look at how do we strengthen the neural networks that help us to direct our attention and help us to self-regulate, it comes back to regular, sustained practice over time. Oh, there we go, 10 minutes, thank you. And so, again, something you don't have to go to an ashram somewhere and take it all on, but it is important that the person who's leading the practices believes in them, has experience with them, and can present it. Because otherwise, if you're like, all right, everybody stand up, do a yoga move, sit down, okay, now we're going to go on. That's not going to be very effective, right? It's bringing it into these key aspects. Let's see, what am I doing here? The other thing, so I was looking around for information. I was super excited to find that there is a program here in Richmond. There's a whole bunch of different programs. So if we're looking at other aspects of how do you take this information and apply it to the work you're doing? So this woman, I'm remembering her first name is Nikki Myers, I think it is. She has Yoga 12-Step for Sustainable Recovery, so I think it's Y12SR. And there's some research links on there or whatever, but the idea, or what they do is they integrate both the 12-step processes and the elements of yoga and yogic practices in terms of fostering, taking the same constructs and the same steps that you're going through that, but then finding how does this apply and layer over it in terms of real embodiment and physicality for cultivation and training of these different factors. This was some, it can also be, I also love this practice because language can often be a barrier. I do work around the world. I had a Fulbright fellowship and I was in the Republic of Georgia, which you can see over here. It's squeezed between Russia and Azerbaijan and Turkey. And these were therapists that work with torture survivors, and burnout was extremely high among them, secondary trauma and the like. And so we worked on doing training to teach them mindfulness-based practices, and found that it helped to mediate burnout. And while they increased in terms of empathy and were able to be effective with the folks they were working with, it helped them to be able to sort of not take on all the suffering that they were exposed to, but to be able to be with people and then be able to step away from that when they needed to later. Africa Yoga Project, this is some super cool work as well. And so looking at, again, low cost, no cost, self-directed, limited resources, whatever, but looking at ways for in terms of prevention and recovery from trauma and stress. So this is just looking at, these were some of the Sai warriors. This was in a prison in Kenya. And that's a community program as well. Direct mechanisms of how does mindfulness help relate to substance use prevention. So the mindful attention helps to reduce cravings, because you're able to recognize physiologically where these cravings and these sensations starting to originate. Whether it's a sensation from an unpleasant feeling that's a craving for a way to alleviate it, or what. There's been some great research done around, particularly with nicotine, and more, and also with opioids. So Eric Garland's work around that. Mindful attention reduces neural activity in terms of the areas that get strengthened, because we know that the processes and it's a learned behavior, and so that the go-to means of how do I respond to unpleasant feelings and emotions or whatever has been to reach for whatever the substance or behavior is that helps to alleviate that. And the key thing here is again, not just knowing like this is not helpful for me, but how do I change and strengthen the neural connectivity in the areas that are in my own best interest or in the interest of folks, so that I can make an informed choice rather than just falling to a reaction that I'm used to doing. And again, going back to the default mode network. So reduction in default mode network activity and reducing in terms of mind wandering has been shown to be key for improving sustained recovery as well. Some of the indirect influences is that it mediates anxiety and mediates persistent depression. And so since those factors are often co-occurring with and precipitate substance use and relapse risks or whatever, it's important to get those under, be able to manage those in effective ways, as with post-traumatic stress. Let's see. I'm going to whip through this. I just wanted to show real quick, we're looking at sort of from a basic stress as well as trauma component. If we look at how the brain naturally responds to stress, the activity in the prefrontal cortex, which is our new brain and where our thinking occurs, that tends to be weakened and kind of damped down. The thalamus is the area that takes in all sort of sensory information. And so when we look at interoception and sensing within the body, proprioception, sensing around the body or whatever, that's where that input comes into. But under normal circumstances, the amygdala, so the amygdala is our security guard that's kind of driving things. These two areas get strengthened, right? So we are reacting in terms of personal safety and security. And the prefrontal cortex is not so connected. So with mindfulness-based meditation and mindfulness-based practices, including yoga and the like, it helps and it changes the thought processes and the response and sort of slows things down. And what happens is then we see that the thalamus, which is our sensing input, and the prefrontal cortex, the connection between those two areas gets strengthened. So you're aware of what's coming in and what's going on or whatever, and you're able to choose a response rather than just to react. The amygdala takes takes a backseat in that regard. So in terms of looking at how you apply mindfulness skills in terms of responding to triggers and cues, that the circuits in the neural networks that that get strengthened, you can establish, and it's easier to cultivate new behaviors and to become aware of what's happening, so you can interrupt sort of the habit loop. It's a decoupling of the behavior, and it provides people with a little bit of distance so that they can sort of observe what's going on in that context as well. This is, again, I'm going to whip through some of these things. These are super helpful. This is from some research, again, by Eric Garland, and where he looks at in terms of how does the mindfulness-based intervention, how do these techniques help? What are they? So the key elements of mindfulness-based practices and prevention is awareness of breath, breathing, meditation, body scanning, so sensing, connecting closely and becoming aware of small vibration sensations within the body so that we have a connection between mind and body, being aware of craving response, and then also some things like moving, yoga, and then bringing it into your everyday life, so we look at informal practices. The biological mechanisms, so amplifying and strengthening prefrontal cortex activity, decreasing the limbic system, so that's where the amygdala is in our reactivity process, sort of the old brain, and improving sort of autonomic regulation. So autonomic regulation, if we're looking at the autonomic nervous system, the two key areas are the sympathetic and the parasympathetic. Sympathetic is activation and everything's jacked up, and parasympathetic helps to slow things down. Way to keep that in mind is like a parachute, bringing things into. And so being able to physiologically respond to those key things. We restructure the reward process. right? So recognizing that and looking at internal mechanisms for that. And you can read through the other key things. But one of the key things, too, here is we're looking at decreasing drug cue reactivity, right? So if you, something that you might smell, see, pick up on, physical sensations or whatever that otherwise might be a strong risk for using again or using initially as well. This is another graph and an image from Eric Garland's work, and looking at understanding the mechanisms of how mindfulness can help in terms of these factors and the processes. And I won't get into all the key things here, but the interoception, right? You're looking at understanding the physiology and physical aspects of what's going on within you. What are you feeling and what are you sensing? Is it hunger? Is it anger? And being able to then choose a response to that. Appraising what's happening in a more objective, distanced way. Urge surfing. So one of the great things when we look at here with Alan Marlet's work around mindfulness-based relapse prevention. So again, this goes back to that idea of you can't change everything that's coming at you, but you can learn to sit, sort of surf and ride the waves of chaos and stress. And with craving intensity, and we're looking at in terms of trying to change patterns of behavior, the understanding that any craving has about a 15 to 20 minute window in time period is really, really helpful for folks. Because other words, that craving feels like it is unending, unyielding, intolerable, and you figure, I'm just going to give in to it because then I can get on with things, because other words, I can't. And so the skills, the ability to watch what's happening with yourself during a craving process, to be able to tolerate, expand that window of tolerance and deal with that. And if you make it out of it, then on the other side without using, right, you get to see what the picture of it is. And what the research shows when they with this is that the intensity of the craving subside over time. Not just because time passes, but that objective capacity to observe what's going on with yourself and give yourself some distance. So I am not my craving. I'm a person who has experienced a craving. That's a difference in terms of that context. These are skills for working through urge surfing. So this will be on the PowerPoint that you can read afterwards. This is just some diagrams for understanding kind of tracking and sensing, so that you become familiar with when you're feeling good as well as when things aren't going well, and you can catch those triggers beforehand. Hopefully this is a rehash of things I covered before, and I think I'm out of time. So I just want to bring it back to closing it out again, and to encourage people to look into more of this work and the research around this, and to also understand the context of, again, even though there's stress and trauma, it's an opportunity for resiliency and growth, and that we're not broken, but it's just like when a bone heals or whatever, it heals stronger, and out of suffering comes beautiful things as well. And with that, I invite you to take another breath, deep breath in, and a deep breath out, and open it up to a question or two if we have time.
We have about 5 minutes for questions.